So some of the most common myths that I've come across in the South Asian communities are the worry about being on insulin. And the worry kind of extends to maybe people that they've seen, people from back home that they've encountered, mainly that they've associated that those on insulin have ended up with an amputation. So the bit in between of why they had the amputation was kind of skipped, so it was just kind of insulin equals amputation. But what I'd like to say that that's not the case. Unfortunately, consequences like amputations and sight loss and kidney disease and things like that are a result of diabetes if diabetes is not managed properly. And one of the ways of managing diabetes is using insulin, and traditionally we would maybe start at a diet level depending what your sugars are doing, and then move up to the oral medications, so the tablet therapies. Then after that, if the sugars still aren't very well controlled, then we'd go to insulin. In type 1 diabetes, it's slightly different, where we would go to insulin straight away, but that's just focusing on type 2 at the moment. The worry often is that, but it's just to reassure people that if we control your diabetes well, hopefully we can reduce those risks and complications. So in terms of males and females, the myths around diabetes are very similar. The one difference is that our female population, especially in the South Asian community, and actually this is probably a concern that extends to all communities, that there is a worry about having children, getting pregnant. But again, another word of reassurance is we as your healthcare professionals will be involved in your care throughout your pregnancy journey and that preconception journey, which is when you're trying to get pregnant. We will give all the advice and direction needed to help and make that journey as smooth as possible. So you won't be left alone, and things will be monitored very closely to again reduce those risks. And most people have healthy pregnancies throughout their journey. So lots of people think that sugar causes diabetes directly, and that the more sugar you eat, it means that you will get diabetes. That's not the case. Unfortunately, within our South Asian communities, we're 6 times more likely compared to Europeans to develop diabetes. So we can say it's in families, and just our general genetics are built up in a way that that risk is higher for us. So the link to say that sugar directly causes diabetes is incorrect, but the link to say that sugar pushes up your sugar levels within diabetes, that's true, but sugar itself isn't the only thing. Things like carbohydrates, fats, processed foods, lots of other different things can push up your sugars too. Many people think that herbal remedies are the way to control diabetes. So I think the thing to think about is lots of medications actually come from plants. The difference between herbal remedies, and we're talking about the herbal remedies that maybe you can buy from different health shops or from somebody that you know. Now, the difference between the medicines that we prescribed is that those are evidence-based and they're regulated. What that means is we know exactly what's in them and how much is in them. The problem with the herbal remedies is we don't know exactly what's in them and we don't know how much is in them, so they can vary from tablet to tablet. So that's one of the issue. The other issues are that, again, like I said, they're evidence-based, so we know that those tablets work, the ones that we are prescribing. I can't tell you about the herbal tablets because I can't tell you that they definitely work. They may help in different ways for different people, but I don't have any studies or evidence to back a lot of those up. Within the South Asian community, there's a vegetable often eaten called chlorella, which is a very bitter vegetable. Lots of people think that forget the medications prescribed, let's just take some chlorella and control our diabetes that way. It is a healthy food because it's a vegetable, but you cannot control your diabetes just by eating chlorella. So to conclude, there's nothing wrong with taking, the vegetables or herbal medications. My advice would be is that consult with your GP or your healthcare practitioner if you are going to take them. But the main message is don't take them instead of your prescribed medications, because at the end of the day, our goal, just like your goal is, by having these herbal medications, is to control your sugars, and we need to do that together. Lots of the myths about how to control your diabetes, what diabetes means. can come from maybe different family members, different friends, and actually, as we discussed, diabetes is very common in the South Asian population, so it's very likely that you're going to know somebody else with diabetes. I think it's important to remember that you need to get your tailored information from your healthcare practitioner. There is also the internet, which is absolutely great because you can get lots of different advice on there. But again, it's really important to follow Diabetes UK, the NHS websites to get the correct information, because we know that there's lots of misinformation circulating and lots of people may present as experts on videos, but there's no way of verifying those people, which means that the information that they may be saying is incorrect, and that can affect your health. So the internet is a great place, but please try and go to those websites that are going to provide you with the correct information. Like I said, Diabetes UK has lots of information on there in different languages. So if English isn't your first language, or maybe you struggle to read in English, there are resources in Bengali, in Bangla, in Urdu, Punjabi. So have a look. There's some videos and written resources that you can hopefully learn from and help manage your diabetes with. Lots of people view diabetes or feel that there's a stigma when you're dealing with diabetes. What that means is lots of people feel that maybe it's a weakness, it's a sign of weakness. We talked about various myths, and people don't always want to disclose if they're getting married that they have diabetes. They're worried about what other people may say. Or if they're in a gathering, a family gathering, or out with friends, they feel worried about what someone else may think or feel, because they may think actually that person is weak. That's not the case, okay? Lots of people have lots of chronic conditions, and diabetes falls in a chronic condition. So it's not a sign of weakness. There are so many people living with diabetes. What we need to do is normalise living with diabetes and normalise doing what we need to do to better our diabetes. And if we're surrounded by our friends and family who love us, hopefully they can help make that journey more smooth. And in the long run, the people around you don't want you to get sick or suffer with the complications. So open up to them, have those chats with them, and hopefully anything that you do moving forward, like going to a family gathering, things that you're going to eat, you can all help each other to better things. So just open up. It's definitely not a sign of weakness at all. In our community, we're a very caring community. We care for our generations above and below, and it's embedded into us that we're always making sure that we're looking after our elderly, our parents, our grandparents, and that's really important. Our aunties and uncles, we're always continuously checking in on them, and many of us live with maybe 3 generations in the house, which is lovely, and it's definitely a huge positive from the South Asian community that we've continued to keep that going. There is a view that if you are caring for our elderly relatives, then you should care for them by just letting them sit, and everybody else does maybe the cooking and cleaning, and as a result then it makes the elderly person a lot more inactive, even if they could be more active. That they are then becoming more inactive, and so they're moving a lot less. Now, as we talked about, one of the ways of managing and controlling your diabetes and making things better for your life as a whole, not just your diabetes, but your whole health, including your mental health, is moving more, exercising more. So I think it's really important to grasp that getting the elderly relative to walk around more. So it doesn't need to be that they're cooking in the kitchen necessarily, but maybe they can stand up and walk around, or actually encouraging them to go out for that walk and exercise is really important. If they're struggling with joint problems, or they're a bit more immobile and they can't get out and about as much as maybe they could 15, 20 years ago, then, doing a bit more in the house. So it's looking at what can they do to stay active. So I think we need to take away that negative thinking of anything that they do in the house means that you're being maybe disrespectful to them, and not giving them that honour. It's really important to remember that part of looking after them is also looking after their health. And one big way of looking after their health is getting them to get up, move around, move more, and hopefully get the exercise in as well. As we talked about, there's lots of myths in the South Asian community, but like we said, it extends to lots of different communities. But specifically, I'd like to talk about within our South Asian communities today that There are ways of breaking down these myths, and that's what we need to all proactively do as a society and a community, because we need to help each other. With this disease, we know it's very, very prevalent within our community, so let's work on it together. I think it's really important for those who are worried about the fact that they may have diabetes, please go and see a healthcare professional. And those who are diabetic and you're worried, come and have a chat to us. Let's normalise things. Come and speak to us and see what we can do and help maybe. There are lots of community groups that may be able to help. There may be lots of the misinformation, misconceptions, and we may be able to direct you and signpost you to those organisations that may be able to better help how to manage those difficult situations if we aren't able to.